So today we will start full orientation to the writing subtest for occupational English test exam. Typical organization of a referral letter, and then we will write a letter together. Name and address of the recipient, date, okay, will be given, or it will be the date of your examination, your OET test. This is the date of referral letter. It is like a true referral letter, okay? So this is the date, and after that you will leave a blank, and you will make a salutation, dear Dr. Smith, okay, or dear doctor whatever, or dear doctor only, or dear sir, madam, comma. After that, name and the age of the person of referral, like regarding, this is John Watson, aged 71 years. Introductory paragraph must be short and summarize the patient's chief details and complaint, and what I want from the recipient to do about that. Okay, I'm writing to refer, or thank you for, I prefer to say thank you for seeing, and name of the person referred. Further information like medical social history, then the visits, the main visit, the main cause of the visit, or chronological, like first visit initially, and then secondary visit, or second visit, and why you want to refer, like discharge plan and treatment plan. And please do not hesitate to contact me. This is the conclusion. And yours sincerely, doctor. Okay, yours sincerely. This is a capital. This is the shape of capital U, Y, okay, and S like S, small letter, and then doctor will be like this only. Don't leave a blank. Okay, I will show you what I will do in my exam. Okay, I will go back for a transfer letter later on, but I will show you now. This is the true writing subtest. Okay, this is a sample test writing. You will write down your candidate number. You will write down your fourth family name, which is your family name, like Sunam, Ahmad, Muhammad, Ibrahim. So the Ibrahim is the family name, and the city, date of the test, and the candidate signature. Okay, then you will have 5 minutes with no pen. How to write? To be or HB. To be or HB. To be for writing, listening, B and C. HB or to be for writing according what you will use to okay, what you will be used to be practicing with. Okay, so you will have reading time 5 minutes and writing time 40 minutes. So the net will be 45 minutes. The first 5 minutes you will never hold the pen. Okay, don't hold the pen, don't hold your pen, just concentrate on reading. What I will do in this, I will go back, I will go down until reaching the writing task. Okay, don't go from up, but like this, go to the writing task. So this is our beginning. This is our beginning. Writing task. Using the information in the case notes, write a letter of referral. So this is a referral letter. Okay, for further investigations and definitive diagnosis. This is called management or assessment. So this is the purpose of the referral letter. To gastroenterologist, Dr. Jason Roberts, and this is the name of the doctor, specialty of the doctor, and the address of the doctor. So now you are ready to write a referral letter to Dr. Jason Roberts, then gastroenterologist, and then Newtown Hospital, 111 High Street, Newtown. Okay, then go up. Okay, this is you have to know that before that expand the relevant notes into a complete sentences. Do not use note form, use a letter format, and you should write from 180 to 200 words. Okay, how to go? So I will start with the bottom of the exam booklet. Then I will go to the notes. Now you have 3 steps. Okay, 3 steps. First step, you will have to select a relevant case notes. What is the relevance of the case notes? This will be according to the recipient. What exactly I want the recipient to know about the patient. So this is the relevance, the relevant data that the recipient is supposed to know about the patient. Again, relevance is, I am referring now to a physiotherapist. So what exactly informations are necessary or semi-necessary for the recipient or the physiotherapist to know? So this is selecting, called selection. Number 2 is transforming. Transforming. I should transform this note forms. This is not complete sentences. I have to transform. How to transform? By making them complete, reasonable, grammatical, organized sentences in a story pattern. Again, this is called the transformation. How to transform these notes into story with complete sentences, grammatically correct and organized in a chronological manner. This is called the transforming. And don't forget to paraphrase or rephrase. What's paraphrasing? Is changing the words in the case notes by another word, synonym. Synonym means the words with the same meaning. Number 3, organizing. How to organize these case notes scattered everywhere into a story, into very organized story. So how to do that? Chronologically. I will be with you from the beginning. So now about, this is the patient name, Anne Hall. This is Miss, okay, Miss Anne Hall. This is the date of birth, 1965, okay. This is the height and weight and body mass index. So this is the body mass index on this date, on 18th of June, 2010, okay. Social history, she's a teacher. Okay, she's divorced with 2 children at home. Okay, non-smoker. So how to select? Okay, I will start by selecting, but not right now. Now, this you will select easily from social and medical history, so don't worry about that. Okay, you will do like with your pen, make like that. This is an whole, okay, relevant, date of birth relevant, body mass index in that date may be relevant. Teacher, this maybe she's a teacher or not, I don't know. Okay. She's divorced with 2 children in social history. I will include that. Social drinker. Okay. And non-smoker. Okay. Maybe. Okay. Okay. So all of this relevance. This is allergies, codeine, okay. Very important for any doctor to know that this patient is allergic to some drug. Maybe not house dust mites or sulfur dioxide. So as you like, as you wish. This is called semi-relevant and as you wish. So this is the family history, and we said we will include family and social history in one paragraph. Family and social history in one paragraph. This include allergies. This is called medical history, social history, and family history. She has a mother with hypertension, asthmatic, father with peptic ulcer, maternal grandmother died of heart attack, and so this is a gastroenterologist. All of that for me is non-relevant. It's not important to know all of that. As a doctor, maybe the mother will have hypertension and father is with peptic ulcer. This is relevant for her condition. Past medical history. This is the past medical history and surgical history. She has got childhood asthma, chickenpox, measles, and all of that. What is important for you? You have to select. Maybe she's overweight and she has got depression, okay? But whiplash injury, sebaceous cyst, hepatitis A, whole family infected, maybe. Okay, tonsillectomy, not for the gastroenterologist, with childhood asthma and some diseases, okay? So I'm going like that during these 5 minutes. So this dyspepsia for a gastroenterologist, it is important. Dermatitis and oral or yes, maybe corticosteroids caused her peptic ulceration or whatever. Okay. So this date, 18th of June 2010, she has dysphagia to solids, onset 2 weeks ago, maybe post-viral, maybe this, maybe upper respiratory tract infection, self-limiting or self-medicated with OTC herbal product, not important, no relapse, no sensation of lump, no obvious anxiety. This is examination. Concomitant epigastric pain radiating to the back at the level of, so this is epigastric pain. Weight loss 1 to 2 kilograms. Recent increase in coffee consumption, yes, this is important for gastroenterologist. Takes aspirin occasionally, yes, this is antiprostaglandin drug, no other non-steroidal anti-inflammatory drugs. So all of this relevant. So after selecting these case notes, you have to organize this only one visit. So you have to organize this one visit into a letter. How to do that? Selecting, go from down to know the first part of your letter. This one. You will write here like this. Dr. Jason Roberts. Then the specialty. Gastroenterologist. Here it is missed, but should be written. Okay. Newtown Hospital. Very nice. 111 High Street, Newtown. This is the first you have done from the lower part of the task. Then you will write today's date after leaving a blank. Then today's date by any format. I will show you in this file how should you write by many formats of the date? The most relevant one, or written by many official samples, this 00, okay, full stop, 00, and the year like 000, okay. This is the date, and then leave a blank, and dear Dr. Roberts, here it is missed a comma, okay. Dear Dr. Roberts, the second name of the doctor, don't write the first name, write his second name, Dr. Jason Roberts, so you will choose this name, so dear Dr. Roberts, and regarding semicolon, oh, so sorry, this is a complete colon, Miss Ann Hall, comma or not, date of birth, like this, and try to write it correctly, complete, okay, by writing 19th 09 or 09, I mean, to be the same format as the official website. Then write, thank you for seeing Miss, second name of her, of the patient, Miss Hall. Okay, thank you for seeing Miss Hall, comma, a 44-year-old secondary school teacher. So this is called compound adjective. So this is hyphenated compound adjective. Secondary school teacher may be the profession used here, or a patient, not necessary, but a teacher is a profession of stress, so maybe interfere with the peptic ulceration or whatever. Okay, who is, so comma and comma, and then who is presented with a 2-week history. Who is presenting with, or who presented with. So who is presenting right now? She's presenting right now. This is present continuous. So she presented past simple, or she is presenting right now. This is present continuous. With a 2-week history, not 2 weeks. This is called hyphenated compound adjective of history. So 2-week history of symptoms of dysphagia for solids. How we know this is 2 weeks history? How? Okay, from this, I will show you how you should analyze and know this is 2 weeks ago. Okay, so this is the presenting complaint, dysphagia to solids, or for solids 2 weeks ago. This is 2 weeks, okay? For solids, I don't prefer that. Try to tell him who is presenting with a 2-week history of symptoms of dysphagia. Don't include all of these details. I need concise introductory paragraph, okay? And concomitant weight loss. So this is a second complaint. The symptoms follow a constant course. This is wrong, okay? Here you will write a full stop, and you will write your further management should be, or would be highly appreciated. Your further, this is the second sentence. Your further management would be highly appreciated. Okay. Now I will come to social and medical history. Right, as I said, as you think appropriate for the recipient to know. Okay, by the way, this is a sample test from the Occupational English Test website. So it's not mine, it's done by them. So it's very nice, but no faults, okay? No grammatical mistakes, no inappropriateness of language. So this is correct letter and organized in chronological correct way. So this is correct. Miss Hall believes the problem commenced after an upper respiratory tract infection. 2 weeks ago, so he mentioned here 2 weeks ago, 2 weeks ago. This is not good, okay? For which she self-prescribed and, okay, this is another fault. She is or she was prescribed or she was self-prescribed. But here it is for the self, maybe this is the verb because she took this medication by herself. So no problem. She self-prescribed over the counter. Try to take OTC over the counter like to analyze the abbreviations into complete words. This is not wrong. Over the counter, this is hyphenated and small lettered adjective, compound adjective for the Chinese herbal product with unknown ingredients. Full stop. After that, however, she has also recently increased her coffee consumption. Look, this is called fancies. Okay, like I will show you how to use punctuation and how to use comma in the previous file. So however, this is clause of contradiction or comparison, like however, although, and this very important to include to make the reader excited to read what you've written. Increase fancy words like unfortunately, consequently, subsequently, moreover, thus, hence, and all of that. However, she has also recently increased her coffee consumption and takes aspirin 2 to 3 times a month. Okay. She has a history of dyspepsia. She has a history of dyspepsia. Okay, this is dates written here, no problem. This is like abbreviation. After, before and informality, try to involve a comma. And dermatitis for which she was prescribed. This is what we call passive, and this is in the same file. How to be grammatically correct. She was prescribed oral and topical cortisone. This is, we said this is relevant. Full stop, there are no apparent signs of anxiety because of stress, and she has not smoked for the last 15 years. She has not smoked. This is present perfect that has effect on the present. Okay, so she has not smoked for the last 15 years. Very nice. She drinks socially. She drinks socially. This is usual. So this is usual. So use present simple. Don't ask which tense I should use for each paragraph. This is wrong. Don't learn that. You have to be oriented. How to use I have been knowing Dr. Ahmed for the previous 5 years. I have been knowing. I have been knowing Dr. Ahmed for the previous 5 years. This is present perfect continuous. Why? Because this has happened in the past, continuous right now, and will continue because I know Dr. Ahmed right now. I have been learning English for the previous 5 years. So I learned English. I'm learning it right now, and I will continue to be learning English. Okay. I have recently passed my exam. So I have recently passed. This is indication for present perfect. What's the present perfect? Present perfect is have or has plus past participle. This will be used for what? For indicating an incident that happened in the past and has an effect on this has an effect on the present. Okay, like I have done an accident. Okay, so this accident has effects right now. So I had an accident. This means that this accident has no effect. So you have to be oriented with some of these tenses. Okay. Okay. Has. Okay. She has and has also. This is comma because he will increase and. So complete sentence without subject and complete sentence without subject. She drinks socially, has a family history of peptic ulcer disease, and she's allergic to codeine. Here, father with peptic ulcer, not necessary to mention father and mother and all of that. Please note, her body mass index is currently 28.2. Okay. So my provisional diagnosis at this point is gastroesophageal reflux, okay, with possible structure, okay. I am therefore referring Ms. Hall to you for further investigations, okay. Thank you for assessment and ongoing management for this woman. If you require any further, so he thanked here. This is called thanking, but for me, it is good to start by thank you for seeing, and this will be enough. Assessment and ongoing management, including investigations or investigation of this woman. If you require any further information, please do not hesitate, don't increase. So this, all of this information concluded in one letter. By the body may be 2 paragraphs, 1 paragraph or 3 paragraphs, but this is outside the conclusion and the introduction. Yours, the W like that, sorry, the Y like that, this is small like that, and comma, he missed here the comma, doctor without leaving any blanks. I will now leave this, okay, to come to discharge letter, okay. So don't worry of how, which should be selected or which drop as much as you see. This is not appropriate or this is not necessary for the recipient to know. Okay, I will now go for discharge letter. But before I will go you now, before you forget, okay, I will take you now to this. This, try keeping your information and your template in your mind so that you will never lost. Thank you for seeing Mrs. Ghada. A 25-year-old patient or profession, but try to hyphen this hyphen here, old patient who first came to see me on, not no, who has been suffering from or he is presenting with, or whose signs and symptoms are consistent with or suggestive of or complaining, or she's complaining of, and this is the disease, accompanied by, or whatever, don't. Okay, and here you're like this. Okay, your further management would be highly appreciated. So, by the way, this is called, I want you to add like this. This is orientation of punctuation. To add any sentence between two commas, this may be dropped in the basket without affection of the sentence. Okay? Then go for the second paragraph. Write the history, social and medical history. She has a 5-year history, 5-year history, okay, of a 5-year history of blah blah blah, which is well controlled by blah blah blah, or she has been on penicillin for the disease. She has been on like that. She has been on drug for the disease. Okay. What is more formal, active or passive? More formal to be passive. She was commenced on, she was on for this disease. On examination, I found not, this is not good. More formal, more passive. More passive, more formal. She was found on examination to be diabetic. Or she was found to be any problem. On examination, the patient was found to be very nice. Upon examination, the patient was like that. So it is more formal to be passive than active. Or examination revealed more than will elevate your marks more than showed. This is called band vocab. Okay. So further investigation revealed. Investigation is uncountable. So don't add a or an. I gave the patient. This is not right. The patient was given. The patient was commenced on drug for the disease. The patient was commenced on. The patient was prescribed the drug for this. The patient was initially treated with. IV fluids were given or were administered. Blood tests were ordered. The passive. The passive. The passive sentences are more formal than active sentence. The patient was advised to infinitive. The patient was advised on gerund, verb plus ing. Okay, the patient was advised to. It was suggested to the patient or for the patient that complete sentence. Bed rest and the hot bags were, and all of that. So this is a type of conclusion. I would appreciate your urgent assessment of this patient. Would you please examine Mrs. X and recommend some appropriate treatment? Could you please arrange to admit? Could you please discuss with her the possibility of? So should you require any further information, or should there be any queries, please do not hesitate to contact me. Here, do space, not space, don't add any abbreviations or apostrophes or like that. Okay. This is a discharge letter because you have done admission. Okay, you have done admission already. Okay, so this is a discharge letter example. Diagnosis: musculoskeletal chest pain, ischemic heart disease, and so you will write, thank you for seeing this 25-year-old woman who is being discharged today into your care. And in between, you will write the details of admission. Okay, details of admission. But this is very concise here. Don't go for that. Please be, as I said, you will go for admission, why the patient is admitted, what done during the first hospital admission, and why you are discharging him, for which purpose you are discharging him. So admission details are very vital. Admission details include what? Admission details include admission criteria for which she has been admitted or he has been admitted. Then the discharge date, today, okay, he is being discharged into your care. Okay, I will write with you a complete discharge letter. So this is admission, date and date of discharge, and information given. So name and address of the recipient, like the same like referral letter. Date, the date of your test, dear Dr. Smith, name and the age of the person, and introduction must be short. When the patient is being discharged today, the patient chief complaint. So you will write as following. Thank you for seeing Mrs. Hala, comma, a 25-year-old female patient, comma, who is being discharged today into your care. Full stop. The patient or she was admitted for, or she has been diagnosed with the disease. Full stop. Your further care would be highly appreciated, or your further management would be highly appreciated. So further information regarding the chief complaint and recovery status, that this is called the admission criteria and discharge criteria. Admission for the main complaint and recovered so that we discharge for a secondary plan or for whatever. So discharge plan, treatment plan, and medications given. Concluding, please do not hesitate to contact me. Sign off, yours sincerely, doctor. Don't complicate it. By the way, I told people with community nurse in the last exam, community nurse letter, I told them you have done perfectly, and many of them have passed the exam because the community nurse is not unusual person to discharge for him a patient, to take care of whom duties or whatever. So the same like referral letter, it's not a problem. You are discharging him as you are referring him. Okay. So in the beginning of the lecture, I have done this assessment criteria written by sentences. What is the assessment criteria and how to control linguistic features? Okay. Okay, before you write, you should know the countable nouns, the articles, and all of that. So you have to know if the article is required or not, depends on depends on the noun. For this purpose, nouns can be classified into two types: countable, uncountable. The difference is based on on whether the noun can be counted or not. For example, complaint is a countable noun as it can be counted. 2 complaints, 3 complaints, 4 complaints. Therefore, it is possible to say 2 complaints or 1 complaint or a complaint or a severe complaint. But advice, on the other hand, cannot be counted. So you cannot say 2 advices. Called 2 pieces of advice, uncountable. So these nouns have a singular form and a plural form. This is for countable. Complaint, a complaint or 2 complaints, or for each complaint, but plural do not use before the noun an article. Okay? Remember, always use article when referring a particular job, such as doctor, scientist, nurse, etc. What are countable nouns? Abscess, ache, accounted, appointment, cavity, a checkup. So all of these are countable nouns, has a singular and has a plural form. Could say a checkup visit or a checkup, a cavity, a complaint, an appointment, an accountant, a severe ache, an abscess, okay? A condition, a doctor, an episode, examination, an examination, okay? An increase, a smoker, he is a smoker, a painkiller was given. So an article, a review, on today's review, or on his review today, or the nurse received the positive reviews, sensation, social work. So all of this are countable nouns, but uncountable nouns you have to keep uncountable, like accommodation. You cannot say accommodate one accommodation. No, you cannot say an accommodation. No, because these are uncountable nouns. Okay, cancer. You have a lung cancer. This is wrong. Lung cancer. Dental caries. Don't say a caries. Concentration, damage, discomfort. Piece of information. For further information, not informations. A pain, like doctor replied on some of the groups, like say a pain. No, a pain, experienced pain. But if the pain is specific, you can say a knee pain, a right knee pain, because this is specific pain. But as a general rule, pain is not countable, is uncountable. Information, progress, treatment. Don't say treatments. Don't say investigations. Investigation, treatment, research, surgery, not a surgery. Okay. Okay, so this is some of the common mistakes with countable versus. So like this is a patient presented for a regular checkup visit. This is correct. The patient has a tender right elbow joint, a tender right elbow joint, because the body parts are countable. The patient has a pollen allergy because he has an allergy. Allergy is countable. So by the way, I don't keep all of this, but by practicing, I understand it and I got it easily. Like capitals, if the brand name should be capitalized, like Voltaren, Zucor, Ritalin, but if the chemical constituent, you have to lowercase or small lettered letters like penicillin, amoxicillin, amoxicillin, clavulanic acid, and all of that. Names of diseases should be lower lettered, like bowel cancer, blood pressure, diabetes mellitus, epilepsy, but in Parkinson's disease, Bell's palsy, scientist name should be capitalized. Okay. Crohn's disease, Parkinson's disease, Bell's palsy, Down syndrome, all of this should be capitalized because these medical conditions named after the person who discovered them. Investigation should be written small letters like orthopantogram, X-ray, but X-ray, no. X-ray, this is wrong. X is capital, X is capital, and ray is small. So X-ray, X is capital, and ray, this is an exception. So investigation do not require capitalization. Heart and body parts should be lowercase. Job titles like this: institutions, addresses, titles, Dr. Smith, Nurse Jones. Okay, this should be capital. But family doctor to the hospital, she's a teacher, she is a doctor, she's a dentist. This is not capitalized because common nouns do not name any specific parts, persons, institutions, should be small letters. Okay. But I don't small lettered I. Don't I, it is always capital letter. Okay. Dear Dr. James or Jameson, yours sincerely. So this is common errors. This is not penicillin. We said penicillin. And I give you this to read. Look, I'm reading rapidly, so it will not take any time from you. Yours sincerely. This is common mistakes, okay? Yours sincerely written like this in the blue color, okay? Clauses of contrast like although her condition has improved, comma, she is still very weak. His condition has improved, comma, but she's still very weak. Despite noun or gerund, despite an improvement in her condition, comma, she's still very weak. Despite the fact that, complete sentence, comma, another one sentence. Despite the fact that, okay? Even though or although her condition has improved, she's still very weak. In spite of name or gerund, name, okay, an improvement in her condition, she's still very weak. While her condition has improved, she's still very weak. So try to use this. Don't make your letter dry, not exciting for the reader to read. Although her condition has improved, she's still very weak. So this is called okay, this is common mistakes in spite of and versus despite of, but try to use what's common for you. In spite of or despite. Despite this advice, he regularly drinks about 2 to 4 glasses of wine every night, as well as 1 to 2 glasses of scotch at weekends. This is called clauses of purpose, like in order to alleviate pain, the patient was prescribed paracetamol. In order must be followed by infinitive verb. Followed like in order to infinitive. Advice was given to reduce weight. After the verb reduce, it is not necessary to follow with a pronoun. Reduce weight. Okay, to reduce weight. I advised him to reduce weight, or you need to reduce weight. In addition, she had lost yesterday, Dr. George, I told you. In addition, she had lost. You said had lost. Okay, not right. She had lost. If this not effective, or now she's good, so it may be past perfect. But in addition, she has lost. This is more right. And in addition, the patient's weight has significantly reduced. Has significantly reduced because the weight may be the subject. It is not passive. Again, in addition, she has lost a further 10 kilograms of weight, a 10 kilogram of weight over the past 2 months. So over 4 cents from the words that indicate present perfect. She's now obese with a weight of 99 kilograms and the height of, okay, this is a noun form. Okay, she weighs 99 kilograms and is 170 centimeters tall. Okay, today's examination revealed very nice words, so try to learn from here. Try to take these sentences as a guide and the guard from mistakes for you. Okay, if you go like that, you will be perfect in writing. This is about compound sentences and the coordinating conjuncts. The patient is allergic to penicillin. Okay, this is simple sentence. I prescribed Panadol for his hand pain and he was advised to reduce weight and do exercise. So this is called compound sentences, are joined by conjunctions like and they show relationship between ideas. The most common conjunctions are and, so the second clause contains a similar idea as the first. But she does, very nice, she does not smoke and she drinks alcohol rarely. So there be contrasting ideas. She does not smoke and she drinks alcohol rarely. So it's better to say but. She does not smoke, but she is a heavy alcohol drinker. A drinker and a smoker maybe they are countable and they take an article. She does not smoke or drink. She does not, infinitive, and drink alcohol, so her health is good. So you can use she does not smoke or drink alcohol. She does not smoke or this correct sentence. I prescribed Panadol for his hand pain and he was advised to reduce weight and to exercise. In this case, you must add a subject after and, like I told you before, Dr. George. After and, why? Because the subject is different. Here I, but here he. So you have to add and one another he, because he was advised to, not I was advised. So you have to add another subject because it is different. I prescribed Panadol for his hand pain and advised him for weight reduction and exercise. Very nice. Here I didn't add another between and. I didn't add I again because it is the same. It is common for this sentence and this sentence. Like that, you have to know he is a non-smoker and she does not drink alcohol or take drugs. Very nice. Nicole is a non-smoker. A non-smoker. So this is a correct one. And no drinks. No, she does not again, but try here does and not alone. The parents say that immunization were given at birth to both their children, but they have no records to prove that. So, but, don't say but have no, like this, but no record. No. Try to complete it one complete sentence. Jones has been a patient of mine. This is called present perfect. Jones has been a patient of mine since date. And he has been attending and again. And he has been attending because he attended and is attending right now and will attend. So present perfect continuous on regular basis for scaling and cleaning. Okay, so you have to be oriented before you write. For me to correct for you, she is allergic to, the patient is allergic. This is called compound sentences. Also coordinating, it is the same like before, okay? So you have, before writing, you have to know, okay, the formal and informal. Formal and informal. This is casual and this is formal. Requires or request. Say, state that, I stated that. Like, don't say like diabetes. Try to say such as or include. Okay. Believe, receive, received. Became. Therefore, not so. Don't say so. Say therefore. Do not, like that. Say do not. Do alone and not. Thank you. Don't thanks. Very, not so. Not so good, but very good. But it is better to say, don't say so, buts and ands. Say, however, and therefore. Children until a lot of. Okay, so this is formal and informal sentences, such as, not like apple juice, such as, including taking shower, including very nice. Thank you for seeing, don't thanks for seeing. Okay, so thank you for arranging a home visit for this patient. If you have any further questions, please be free to ask me. Don't feel free. I would, okay, regarding his dietary. So you have to be oriented with formality versus informality. Her temperature and blood pressure were normal while pulse was elevated at 88. Therefore, very nice, full stop, one capital letter, therefore, comma, I recommended that she return today for a blood test and reassessment. So once you are oriented to write a sentence, you will definitely correct it right by reading all correct sentences versus incorrect. Okay. A follow-up visit, like that. I am writing to request a follow-up visit. Examination revealed that, one complete sentence, that his vital signs were stable and left knee was swollen without effusion. I recommended further investigation to rule out cancer, not a cancer. And about the formality also, and the medical terminology, you have to concentrate with this: PID twice per day, OBG knocked in the evening, and abdomen, AC before meals, ADL activities of daily living, CO complaints of date of birth, ECG, full blood count, and you have to know this. This means possibility of something. ممكن سؤال، هو الشاشة واضحة قدامكم؟ الكلام واضح قدامكم؟ دكتور غادة الكلام واضح قدامكم أو دكتور مينا؟ الملزمة باينة قدامكم؟ بس تمام الحمد لله، أنا كنت فاكر من الصبح. طيب ديا معناها 6 ساعات، اوكي 6 hours. Okay, this is called 3 months of 11, 3 of 11, 3 months. TDS 3 times a day, SID once a day, tablet, our right knee, QID 4 times a day, PRN as required, past medical history. This is called pulse rate or pulse. No abnormality detected, minute, main in the morning but not in the evening. Okay, so you have to keep this in your mind. Centimeters, gram, kilometer, millimeter, and according, if you want to mention abbreviation, okay, no problem, mention abbreviation. But if the recipient is not oriented with this, try to, for me, try to analyze and paraphrase this: main and knocked in the morning and evening, in the morning at night, in the morning and at night, because I mean 5 milligram in the morning and candy sartan 10 milligram at night and in the morning. After discharge from hospital, Mrs. Jones has been told to take appearance when required, like PRN, and Aldomet twice a day will be more formal and more appropriate and paraphrased. Regarding Mrs. and Mr. and Doctor and date of birth, don't add full stops. Don't add full stops, okay? At all, don't add full stops. Why? I will discuss this later, like American folks and British folks. No, don't. Mrs. without Mr. without Doctor without Mr. No dots, no full stops. To Mrs., Mr., date of birth, DOB without any full stops for the whole candidates. I treated Claudia with a prednisolone 5 milligram tablet once a day, but better to Claudia has been treated or has been taking prednisolone 5 milligram tablet once a day for 7 days, like this. SID once a day for 7 days. On examination, there was tenderness and rebound tenders. Better to say there were. Why? Because this is two and this is not singular, this is plural. So upon examination or on examination, comma, there were tenderness and rebound tenderness over the right iliac fossa. Yes. Don't say right iliac fossa. Say the. Why? Because this is definite body part. Her stomach, his hand, his right hand, or the right side of his hand, like that. I'm writing to refer. No, I like to say, thank you for seeing Mrs. Wilson, comma, a 45-year-old woman who is suffering from signs and symptoms suggestive of advanced whatever. She presented to me yesterday evening with abdominal pain. So she presented, this is past simple. Why? Because yesterday. And even without yesterday, by understanding, by checking which is appropriate, which tense is appropriate. Her mother died of MI, say myocardial infarction. A pulse rate of PR, don't say PR, say a pulse rate of, a blood pressure of beats per minute, a pulse of 88. So it's very easy to check, and this is called parallel structure. During hospitalization, IV fluids were commenced, and another sentence, Dr. George, don't forget, and a transdermal patch was used. This is parallel use. Okay, he is now worried about his condition, but he is overweight, or because he is overweight, comma, the same, lacks exercise and smokes regularly. So this is called parallel structure. With passive verbs, during the hospitalization, IV fluids were commenced and a transdermal patch was used for her pain. With nouns, he is now worried about his condition because of his increased weight, lack of exercise, comma, and his habit of smoking. Gerunds, in order to handle the above mentioned effects, be cautious when driving a car, operating machinery, or performing any hazardous activities, especially after taking your regular dose. With prepositions, threadworms resemble pieces of 1.5 centimeters cotton thread, which is normally detectable at the surface of feces or around. So at or around, because this is called prepositions. I'm worried about Miss Jones and would appreciate your urgent assessment. I'm worried about Miss Jones, and don't say I, because I, it is common. I here represents for this sentence and represents for this sentence. So the important point is to remember that the structures must be balanced, and this is mistakes. So during hospitalization, IV fluids were commenced and used. No. Why? Because this is not balanced, and you have to balance. So during hospitalization, IV fluids were commenced and a transdermal patch was used. Why? Because this is the passive and the passive. Further examination revealed the dry mouth. Further examination revealed the dry mouth. No, there is a completion. In addition, hair dentures were worn out. Okay, so we have done all writing by this way. You should be oriented before you write. Otherwise, you will pass by chance. Okay, many pass by chance, and you may fail by chance. Okay, so in November, in date, in the past, in the future, in the morning, but on Monday, on day, on examination, on investigation, on presentation, on 2 days occasion, but at ساعات, at night, at 6 o'clock, at birth, at the age of 45, at the age of 45, at that time, في هذا الوقت. Okay, at lunchtime, at night, so in the morning, but at night. No preposition, not on today, it is today, or on today's visit, yesterday, tomorrow, last week. No preposition required. Next week. This week, like that. Inside, on, surface, at, activity, place of activity, at work, at the clinic. Okay, and some common errors. Initial examination today revealed inflamed gums. So simple and present perfect. Very nice to read this. Very nice to ask many people on Facebook what to write, present, past, what. So you have to be oriented with the verb at first, and then you will decide at alone. He sucked his thumb until he was 5. He has been sucking his thumb for 5 years. So he sucked, this verb present is past simple. Very wrong. This is not right. So why? Because one incident happened and gone. This is present. This is past simple. But present perfect has effect because this present perfect continuous has been sucking his thumb for 5 years. So this is more right. But this is for if this infant is right now, okay, and this will be good, no problem. Mrs. Kelly had diverticulitis when she was a teenager. Mrs. Kelly has had diverticulitis for. So when, until, time marker for past simple. But for and since for present perfect or present perfect continuous, like has been, gerund, has been, verb plus ing. Since, yet, but here 3 months ago, yesterday, in, year, she first came to see me in 2004. Okay. So according to the time marker, الكلمات الدالة. Okay. Pain in the left. Pain in the left groin. So not pain in left groin, in the left, because this is the correct, by the way, not incorrect. This is correct. Pain in the groin. I suspect it to be adenoma of the parotid gland because this is on the left hand or on the left knee. Okay. The patient is suffering from high blood pressure. Why? Because do not use an article for names of diseases or conditions like a blood pressure, a headache. Okay. She has a family history. She has a family history of the same disease. The same takes the. The children were treated by the same dentist. The medication is the same as the last one or as last time. On review today, Mr. Walker has reduced smoking from 20 to 10 cigarettes per day. The patient was advised to stop drinking, not the drinking. Drinking is a gerund. Don't use the definite or indefinite article with drinking. The patient is complaining of discomfort during the passage of urine or during the passing of urine. This is asked many times about is passing urine or the passing urine. This is for you to read how to count and make singular, plural, and vice versa. Okay, for now I have finished the writing orientation regarding the comma. Okay. Yes, very nice. On examination, comma, unfortunately, comma, I suspect examination revealed. So all of this from OET regarding her medical history, comma, prefer to be on review today, comma, in terms of his medical history. Please note, comma, in addition, comma, this is called appositives. This is a noun or a noun phrase that is placed after another noun to explain or identify. This is appositives. المضاف إليه، يعني كلمة بحطها عشان تعرف أو تفسر، ودي ممكن تشيلها خالص من الجملة هي والاتنين كومز. Mrs. Smith was admitted. Okay, very nice. Mrs. Smith, an 80-year-old widow between two commas, was admitted to the hospital with complaints of heart palpitations. Thank you for seeing Jordan, comma, a 10-year-old boy who presented at my clinic today with a main concern of pain in tooth 54. I'm writing to refer Mrs. Bradley, a 42-year-old. This is called appositives. Conditional, this is called conditional. الجمل المشروطة. If you could take over her antenatal care, it would be much appreciated. So a comma. If you have any further questions regarding this patient, comma, please do not hesitate to contact me. But if, don't forget this, very nice. If in the beginning, if you have any queries, comma, please. But don't use comma if the if clause is at the end of the sentence, like this. It would be greatly appreciated if you could take over her antenatal care. Please do not hesitate to call me. Don't add comma. Very nice. Very, very nice. Again, don't add comma if in the beginning, but don't add comma if at the end. Okay? This is called complex sentences. Use a comma, like in case of irritation, redness, or swelling, please consult your doctor. This is commas between complex sentences. When the results become available, comma, I will forward them to you. Because of her deteriorating condition, very nice, use it. Because of her deteriorating condition, the patient was admitted to the hospital. Don't use comma if the dependent clause المقطع المعتمد على الجملة at the end of the sentence. في حاجة اسمها dependent clause و independent clause. المقطع هل هو مستقل بذاته ينفع تخليهم جملتين كل مقطع جملة، ولا المقطع dependent على المقطع الأول؟ Okay, please consult your doctor in case of irritation, redness, or swelling. Don't use comma if the dependent clause is at the end of the sentence. So here no comma. Here no comma. Please consult your doctor in case of, like if, the same as if, because in case of it is the same as if. If or if the dependent clause at the end, don't use comma. I will forward the results to you when they become available. So this is called dependent clause. Why? Because you cannot say it alone. When can you say when they become available? What's them? What's they? So this is called dependent clause. On, dependent on what? On the first clause. The patient was admitted to hospital because of her deteriorating condition. So don't forget this. Comma splices. He does not have any dental experience and he is worried about the pain. This is correct, but he does not have any dental experience, comma, no, this is called wrong. You have to add art. You have one tool. Okay. Okay. Mrs. Oslin has a history of hypertension, glaucoma, for which she is on regular medication. Very wrong. Why? Because Mrs. Oslin has a history of hypertension, hypothyroidism, and you have to add and at the this conjunction at the end. Okay, comma, and last option. So on review today, you have to read this. He has reduced the smoking. On examination today, there was a soft fluctuant swelling, palpable on the left cheek. So all of this correct. Regrettably, she has problems with breastfeeding and caring for her baby. Please note, she has a prosthetic heart valve. So, like that. Okay, as well as a result of, along with, apart from, learn from here to write strong sentences, strong words that will elevate your level and marking criteria for you. Consequently, okay, consequently, semicolon or comma alone, he has undergone, not underwent or undergo, he has past participle, extensive treatment for carious lesions and oral hygiene. During, despite, on, she presented, complaining of, she presented, and ده اسمه حال يعني شاكية من, she presented complaining of, she presented crying of, in terms of her medical history, in use in terms of, in the meantime, regarding the medical history, in addition to, in the meantime, at the same time, in addition, in order to, in case of. So please be variable in writing. Don't write very silly, short, basic sentences. Yes, Dr. George, you want to complicate. Okay, complicate it right. Don't complicate it wrong. On review today, very nice. She first presented to me on date with several episodes of heart flutter over the previous few weeks. Very nice. On review today, the patient has reduced smoking to 10 cigarettes a day, attended gym twice a week, and lost. Very nice and very correct. Please note, comma, regrettably, recently, since then, منذ ذلك الحين, for this reason, or the reason for referral is to. Very nice. Who said it is wrong? No one. Up until now, unfortunately, with regard to, I'm writing with regard to, thank you for, or with regard to, بخصوص, with regard to. So I have done today. I just want you to write right, okay? Write right. Complicated, but write right. Thank you all. Good night.